Hi everyone! So we have another question here, and let's continue our GI question and answer series. The question here is the client has GERD or gastroesophageal reflux disease, and which of the following diet should be eliminated from the client's food or from the client's diet. So the choices are A. Lean beef, B. Air popcorn, C. Hot chocolate, and D. Raw vegetables. So those are the choices. So basically, first, let's review what GERD is. So GERD is gastroesophageal reflux disease, or from the word itself, it's actually a problem in your upper GI tract. Between your stomach and your esophagus. So gastroesophageal, there's a reflux. Okay, and then it's a disease. Okay, basically the cause of this is your incompetent lower esophageal sphincter or cardiac sphincter. So your cardiac sphincter or LES, lower esophageal sphincter, is a sphincter usually found, it's found in between your esophagus and your stomach. So may sphincter doon. The tone of the sphincter should be dapat mataas yung pressure to hold it. Okay, anong purpose ng sphincter na yon? To separate the esophagus and the stomach, kasi pag kumain ka, okay, of course there is hydrochloric acid inside your stomach. Dapat nakalock siya doon, right? Dapat nakalock siya, hindi pwedeng umangat yung pagkain, hindi pwedeng bumalik yung pagkain sa esophagus because the lining of your esophagus is not meant for the hydrochloric acid. Magkaiba sila ng lining ng stomach. So sa stomach, kaya niyang i-hold yung hydrochloric acid. So when the sphincter is incompetent, pag mababa yung pressure, kapag hindi niya kayang i-hold yung food inside the stomach, what happens is there is what we call the reflux, okay? Na magkukause ng damage sa esophageal tissues mo, and it can cause pain and heartburn, Heartburn, signs and symptoms of GERD. Now, ano ngayon ang dapat na diet? So, one of the most common diet that causes GERD, nagpapadecrease lalo ng pressure ng LES, are your fatty foods, caffeine, soda, spices, what else? Peppermint. So, maraming mga food, actually, mga masasarap na food pa yung bawal. So, bawal pa yung caffeine, kape, bawal ang chocolate, kasi it has caffeine. Of course, bawal din ang mga spices. Kung mahilig ka sa maanghang, okay, so bawal yan. And fatty foods. Therefore, you need to avoid those things para hindi lalo decrease ang pressure ng LES, and so that it can house, or it can actually be competent, no, to close, para hindi bumalik yung hydrochloric acid and cause reflux to your esophagus and hindi ma-damage yung esophageal tissues mo. Therefore, among the choices, bawal ang hot chocolate. I'm so sorry. So, if you have GERD, avoid caffeine, avoid hot chocolate. Hi again. So we have another question, and today the question is about acute appendicitis. And a client with acute appendicitis develops fever, tachycardia, and hypotension. Based on these assessment findings, the nurse should further assess the client for which of the following complications: A. Deficient fluid volume, B. Intestinal obstruction, C. Bowel ischemia, and D. Peritonitis. So, before we answer this question, dapat alam natin what acute appendicitis is. So, sabi nga natin sa nursing, no, kapag ang isang disorder ay nag-end sa itis, it could be an infection or inflammation of a certain organ. In this case, we have an inflammation of the appendix, no? And since sobrang liit lang ng appendix, guys, pag namagayon, it can result to rupture, and pwedeng magkaroon ng pag na-puncture siya, of course, the intestinal contents can actually go through the peritoneal cavity and, of course, cause further infection. So, dun sa assessment finding natin, meron tayong nakitang fever, meron tayong nakitang tachycardia and hypotension. So, mababa ang BP, mataas ang heart rate, at may lagnat si patient. So, letter A, deficient fluid volume. Actually, pwede mo talaga siyang isagot dahil pag mababa ang fluid volume, bababa ang BP at tataas ang heart rate. But the problem is, least likely na makaka-experience si patient ng fever if there's a deficient fluid volume. Kung yun lang talaga yung reason, right? So, least likely na may fever siya. Kung meron man, probably magdi-decrease ang temperature if there's a deficient fluid volume. For intestinal obstruction, bowel ischemia, both of them, it can cause abdominal pain, abdominal distension, cramping, diba? So, wala naman yun sa assessment natin. So, that's why eliminated na ang 2 and 3. So, the only answer left is peritonitis, and that is the correct answer. Sabi ko nga kanina, when the appendix ruptures, the intestinal contents can go to the peritoneal cavity and it can cause further infection. When the peritoneum is inflamed or infected, that is what we call peritonitis. Right? And peritonitis can also cause hypovolemic shock. It can decrease the BP, it can increase the heart rate, plus since it's an inflammation, since infection yan, it can cause fever. So letter D is the answer. Okay. Alright, so we have another question. Sorry, nabuo ako. We have a client with pancreatitis, and here are the assessment findings: a blood pressure of 88/40, a heart rate of 128 beats per minute, and a respiration of 28 per minute. There is also a great turn sign, and what will be the nurse's next action? First, so prioritization na naman to based on our findings. Guys, pancreatitis. Again, itis. So, namamaga ang pancreas. The pancreas is located in the left upper quadrant, right? And, titingnan natin, namamaga yung pancreas, no? Tingnan natin yung assessment natin. So, the blood pressure is 88/40. Obviously, this is hypotension. And then, we have 128 beats per minute, tachycardia. And we have 28 respirations in a minute. We have tachypnea. So, hypotension, tachycardia, tachypnea, plus a gray Turner sign. So, a gray Turner sign is a bluish discoloration, usually located in the left upper quadrant up to the back. So, nandyan siya. And it's an indication that there's a possible bleeding the pancreas, or pwedeng nag-perforate yung pancreas, no? So, if there's bleeding and ganito ang vital signs mo, you can immediately conclude that there could be decreased fluid volume, deficient fluid volume, or hypovolemic shock, right? So, anong gagawin natin muna? A, assess the urine output. B, place an intravenous line. C, position on the left side. Or D, insert a nasogastric tube. So, in this instance, ito yung sinasabi natin na meron na tayong enough assessment to actually conclude what's happening to the patient, right? So, sinasabi natin na possibility, meron na siyang hypovolemic shock. So, what are we going to do? If we're going to assess again for the urine output, ang makikita lang naman natin dun is still the fluid volume or the fluid status of the body, which pwede na nating makonclude na the urine output can be decreased kasi nagdi-decrease ang fluid volume because of the bleeding. So, kung yun ang gagawin natin first, okay, kailangan natin mag-act agad because it's already an emergency. We need to manage. We need to intervene. And in order to decrease the fluid, kasi nagdi-decrease na siya, diba? Hypovolemic shock, para mag-increase siya, next thing that we need to do is to place an IV fluid, to place an IV line, okay, to administer IVF, okay, just to replace the fluid loss dahil sa bleeding. So, positioning can be for pain management, pero hindi siya yung priority. Siguro after maging stable na yung vital signs. And inserting a nasogastric tube, pwede siya if there's nausea and vomiting, pero hindi siya priority at this point. So, priority is intervention and increase fluid volume in the body. Right.